Welcome to The Big Story. I'm Haryanto Diman. Subscribe to the Straits Times channel so you will not miss an episode. The COVID-19 pandemic has been a major test for the world. Now, after weathering the worst of the storm, Singapore is taking stock. Now, what did we do well and how could we have done better? The white paper on the nation's performance was released today. We begin with some of the things Singapore did well. Now, these include saving lives by keeping the healthcare system robust, by expanding healthcare capacity and ramping up swabbing and testing operations, as well as securing early access to vaccines. The nation also kept daily functions running by ensuring supplies, especially medical, were secured. But Deputy Prime Minister Laurence Wong, in announcing the white paper, was also candid about the slip-ups Singapore made. These include the outbreak in migrant worker dormitories, which could have been better controlled. Mr. Wong acknowledged that Singapore could also have been more decisive with border measures to prevent cases from slipping in. The white paper also said we could have been less definitive in our position on mask wearing. Instead, when masks became mandatory, the public viewed the policy as a U-turn, which it says undoubtedly affected public trust and confidence in our handling of the crisis.
We are better prepared, but we are never complacent, and we know that the next pandemic will be different from what we have gone through, just as COVID has been different from SARS. So while the lessons will help give us a better sense of preparedness, we must never fight the last war. We must not allow the lessons to become hard-coded into a certain doctrine that might lead us down the wrong path, especially if the next virus turns out to be very different in character and nature from what we have experienced so far.
Professor Dale Fisher, Senior Infectious Diseases Consultant at NUH, joins me now. Professor, for a start, your thoughts broadly on the takeaways of the COVID-19 white paper and what stood out for you?
Thanks, Haryanto. Let me first start by pointing out that after-action reviews are an important and responsible measure to take after an event such as this. There's just been so much turmoil. It's critical that every country really can look at its performance, and it's not so much about patting yourself on the back, and it's not so much about scolding any aspect to anyone or any area that perhaps wasn't perfect. This is really about learning lessons and working out how we can improve our preparation for next time. So as you know, it's quite a sizable document and there's lots of aspects. But if I could just point out a couple, that certainly in the aspects where it's regarded that things went well, probably the two most important ones that resonate with me are the first two, actually, that the resilience of the healthcare system was evident, that we could rapidly scale up testing even through January and February when other countries were still thinking about it. Those innovative community efforts such as community isolation facilities, healthcare workers going to the dormitories to provide care, all these things that helped unload hospitals, the community swabbing, to allow the hospitals to never become overwhelmed. And that was the situation in Singapore as opposed to elsewhere. The other one was the vaccination campaign, which where they actually described the innovative early procurement, and they used this refreshing, sort of honest, simple language, which is we had to take a gamble. We bet on the vaccine, which is language you don't normally hear in a document like this, and how in June 2020, even though the trials of the vaccines weren't done, that they invested in the vaccine so that with the belief that this would be the way out of the pandemic, Singapore wanted to be at the front of the queue. And of course, we were able to start vaccinating in December 2020 before many other countries. So that innovative early procurement was there, and also the vaccine centres and the rollout across the country was always very efficient and easy to access. So So I think that'd be my two highlights of what went well. What could have been done better, what they did in the early stages of the foreign worker dormitory outbreak was insufficient. So that's really an important sort of confession, I guess, and that's the only way you can really move forward if you establish that. Often we didn't know which workers were in which dormitory because that sort of information wasn't kept. So it's very nice to know that there's many takeaways from the foreign worker dormitory outbreaks. Many of them actually already implemented infrastructure changes, things like this. So I think this is excellent sort of post hoc reviews. They talk about the mask wearing policy. Could we have been less dogmatic about that at the beginning? Of course, there was no evidence, and that was the WHO recommendation to only wear masks when you were sick. But nonetheless, the report suggests that maybe we could have perhaps recommended cloth masks at that time. And also contact tracing. Could we have had the automated systems that trace together in place before the outbreak as part of preparation? Because really manual was very difficult once the numbers got up, as was seen around the world. So, I think they also talked about how the bubble wrapping of people that were importing food from Malaysia and how that was managed to keep our supply lines open. So a lot of refreshing, honest language as this report describes what went well and what could have been done better, and therefore lessons for next time.
Professor, Deputy Prime Minister Laurence Wong said a dedicated forward-planning team will be set up to prepare for future pandemics. What do you think it should entail? What aspects should that team look at in its preparations?
Yeah, well, you obviously need a team, a group of people that can implement the changes and test the changes and make sure that this is not all just a conversation. So I think this group can take the findings highlighted in the white paper. It needs to be whole of government. We've shown that this is not just a health department problem. So every government department needs to have its own preparedness plan for a future pandemic. There needs to be good consultation with the community, I think, to understand anything that affects the community is going to be appropriately implemented. And then I think most importantly, there need to be scenarios where you can actually, perhaps through tabletop exercises, actually see, depending on what type of outbreak it is, how it's spread, the incubation period, all these types of things. Would what we've got in place actually work? So yeah, I think this would be the role of a future committee to implement this.
The white paper does outline the government's preparations for the next pandemic, if and when it happens. But on an individual level, Professor, you, me, our viewers, what can we do to prepare ourselves given what we have been through the last 3 years?
Yeah, we're talking more and more about the value of healthy communities, healthy individuals, and this in itself supports its resilience. So I'd be telling people that we've just seen that a pandemic has come through, and the people that are most likely to get affected or get severe disease are those with pre-existing illnesses and comorbidities. So I think individuals should be just taking the simple message of this is a reminder to be healthy. Get your blood pressure checked, get your cholesterol checked, make sure your weight's is appropriate. Don't smoke. Go to your regular checkups, including cancer screening. All these types of things, I think, are what individuals can best prepare, or how individuals can best prepare themselves. And then, of course, one of the strengths of Singapore's response is that the government and indeed most of the community followed the science. So I think that trust in science, trust in the decisions that are being made on the basis of science are the other way when it comes to responding to a pandemic. That I think that respect for science, and I think that was a strength of Singapore's community response this time.
Before I let you go, Professor, Mr. Wong was asked during the interview on how he would grade Singapore's fight against the pandemic, and this is his reply.
I can't possibly give a grade because I was being examined. So it's for people to examine me and give me a grade.
So, as a professor and an expert in outbreak response, what grade would you give the government?
I'm not sure I'm overly confident with grading the Deputy Prime Minister, but actually I think it's very straightforward, and this doesn't even come from me. This is a worldview that our Mr. Wong and indeed all our leadership would be scored very highly. But it's not only the response. I mean, the preparation's been going on for 20 years, and then when we saw COVID coming, even on January the 1st in 2020, we were doing things well before we had a case, and it's this preparedness and readiness that really sets the scene for the response. So you know, I give credit to the leadership of the last 20 years, really. But I'd give credit to the whole of Singapore, the healthcare workers, the community at large, businesses that contributed, the migrant workers. You know, everyone played their role. Was it perfect? Well, no country was perfect. Everyone's got areas to reflect and improve, but there's no doubt our response was well led, well coordinated. But now we've got this white paper, which is all about moving forward, so we can learn how we can do better.
Professor, always a pleasure to have you on our show, and thank you for your perspectives. That was Professor Dale Fisher, a senior infectious diseases consultant at NUH. In other news, the latest COE tender exercise closing with higher premiums for all categories except one. Category C premiums, usually used for vans, trucks and lorries, hit an all-time high for the third time in 2023 to end at over $91,000. Premiums for Cat B also increased slightly to end at about $115,000, while premiums for Cat A went up by 1.7% to end at $88,000. Cat E was the only one to see a decrease, ending at $116,000, a dip of 1.7%. And those are our top stories today. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by clicking the red button below. I'm Haryanto Diman. Join us tomorrow for more stories on The Big Story.